Evidence-based dentistry is a mixture of taking new and updated information and applying it to our clinical settings. Instead of being a little anecdotal or set in our ways, which is so easy to do, we need to be constantly looking for new and improved information to enhance our procedures. Evidence-based dentistry is important in order to have a healthy and ethical practice. We need to look at new evidence and new studies and continuously apply these new concepts, which are actually backed by data and proven to work, and apply this to our practice. We need to question if our clinical procedures are systematic. It is said that medicine is continuously changing as the wealth of medical knowledge almost doubles every 2 to 3 years. This is why it's important to use evidence-based dentistry to research new concepts which can be significantly proven to work better than the previous concepts that we've been using. Why would we continue to perform a procedure if it's proven to not be adequate? So by taking clinical experience, our patients' needs, and the best and updated information, we can apply evidence-based dentistry to create a well-rounded practice. So I have a clinical situation. I've had a patient with mild mucositis, which is irritating swelling of the oral mucosa tissues. They had just finished with a routine prophylaxis and asked me, would a water flosser be beneficial for my oral health as advertised on TV? Are they worth it, and would I recommend it to them? Well, I've never used a water pick, and our office is not selling water picks at the front desk at this time. So my question is this new oral health appliance effective, and should I suggest it to my patients? So we're looking at a population of patients with mild to severe mucositis. We're wondering if water flossing is beneficial for their health. In comparison of brushing or with a toothbrush, is water irrigation better? What's our desired outcome? We want to see if water irrigation is beneficial for our patients. So I went home and I wanted to find quality evidence to answer my patient's question. I found this study. The effect of oral irrigation on self-administered oral care in the management of peri-implant mucositis, a randomized controlled clinical trial. So in the title, we see it says clinical. It's randomized controlled clinical trial. As we look at our pyramid of quality evidence, we see that this study is under experimental studies. It is randomized and controlled. It's pretty high up here on the pyramid, but is this quality evidence? A randomized controlled trial is a type of scientific study. So this study here is a scientific experiment that aims to reduce certain sources of bias when testing the effectiveness of new treatments. This is accomplished by allocating 2 or more groups, treating them differently. For example, each group may receive different treatment, or the participants can be blind, just like this study, or whatever it may be. Because this evidence lies here on the pyramid, I find that pretty reliable, and how they conducted this study, I think it was really well done, and I will get into that in a second. So the study consisted of 60 patients, and they split them into 3 different groups, just like the definition of a randomized controlled clinical trial. Each group had different instructions, and the patients were reevaluated every 4, 8, and 12 weeks. So over this study, they would come back in, the scientists retrieved new data and documented everything. And the results were really fascinating. So 70% of all the patients actually resolved their disease with the water pick after 12 weeks. So after reading this study, I reached back to my patient via phone call and said, I thought about your question and I've developed a treatment conclusion or alternative method for your oral health. I do believe the water flosser is effective and could be beneficial for you and may relieve the mucositis you are dealing with. Here is my reference of this study. it is an academic journal. And I think this is a great example of applying evidence-based dentistry. We had a question from a patient, we found a study with actual data, and now we can apply this new scientific knowledge to our practice.